Imagine sitting in a doctor's office with your family. You're waiting for what feels like forever, and he finally returns. He walks in carrying a folder, and he could not possibly be walking any slower to his chair. He finally sits down and gently lays his folder on his desk. He's avoiding your eye contact, but after a deep breath, he looks up at you and purses his lips. In that moment, you feel your heart stop. You just start to think to yourself, how could this happen to me? What about my future? What about the future of my family? And everything is just fuzzy to you now. You can't really hear what he's saying, but you do pick out the word cancer. Now, this story might be familiar to some of you, and to others, it's just a distant nightmare that you are praying will never come true for you. But in reality, cancer is the second leading cause of death in America, and Cancer.org expects there to be 1.6 million new cases this year. Cancer doesn't care if you're young or old, if you're male or female, or if you're well off or financially unstable. I know I'm just a 19-year-old, but as a nursing student, I've spent my fair amount of time looking up cancer and different ways to treat it. And in my personal life, I've had many friends beat cancer. And just this past week, my uncle underwent surgery to remove tumors from his abdomen. He's doing very well, in case you were wondering. Today, I would like to help ease some of the anxiety you might be feeling from my introduction and tell you about the 3 most common treatments of cancer: chemo, radiation therapy, and surgery. The first of these is chemo, and it's very well known. It's been around for over half of a century. There's not one specific chemo drug, but there's hundreds out there, and your doctor will choose which one to use and how much of it, depending on what kind of cancer you have and how much cancer is in your body. Chemo's not done to just kill the cancer cells and ultimately cure you immediately, but it can be done to help with symptoms such as pain and to kill the cells that have already started to spread or metastasize around the body. And it can simply keep the cancer from getting worse. And chemo's not perfect by any means. It's targeting any cell in the body that's rapidly growing, like a cancer cell. But this also includes cells like your hair and your red blood cells and your blood in general. So these can create some very awful side effects. Most times you'll get very nauseous, you'll lose your hair, your bone marrow is changing, and you'll have fertility issues. The second type of therapy is radiation therapy. This is when you use special equipment to send high doses of radiation directly to your cancer cells. It can be done as curative or mixed with the chemo and surgery, or palliative just to help you with the pain. Radiation can be done externally, which is where you lay down very still in a machine, and a radiation therapist is watching and monitoring everything. The machine will whir around you and sounds like a vacuum cleaner, but it's directly sending high doses of radiation to the cancer sites. Another type of radiation is done internally through implants. These can be done through a syringe, or they can be placed in an already open cavity, depending on where the cancer is found. And the last type is called systemic, where you basically take a pill and it sends radiation all throughout your body. You'll have to stay in the hospital for quite a few days because then every single bodily fluid becomes radioactive. So it takes a long time, and all of these treatments can be pretty expensive. The final type of treatment is surgery, and it's done normally along with chemo and or with radiation. And there's different types of surgeries, but the kind that I'm talking about is called curative. This is where they've already located where the cancer is, and they know how much is in there, and they know that they can remove the entire tumor or all of the cancer cells. Normally, you do this after you've had chemo and radiation to make sure that the cancer doesn't spread before you start the surgery. And there's also other surgeries that can be done beforehand to know how much cancer there is, where it is, or it can be done when you still have the cancer but you're not quite ready to cure it and you're just needing something to help ease the pain. So today I've already gone over the 3 most common types of cancer treatment, and I made a little brochure that has the 3 different kinds of treatments, and I attached that to the email that I'll be sending. And so, though cancer is the second leading cause of death in America and is expected to affect over 1.6 million families this year, I hope you're able to take some comfort from hearing about the treatments that are offered. There might not be a cure yet, but humans in America are very, very well off, and we have a very high chance of getting back to a normal life thanks to these modern innovations in health.